Good afternoon, everybody. I'm going to represent a measles outbreak that happened in Skopje during 2014. Measles is a highly contagious acute viral illness that can lead to serious complications such as blindness, encephalitis, severe diarrhea, and dehydration, ear infection, pneumonia, and death. It is spread by coughing, sneezing, close personal contact or direct contact with infected nasal or throat secretions. There is no specific antiviral treatment for measles. It is a vaccinal preventable disease. According to some facts published by WHO, in 1980s, before widespread vaccinations, measles caused an estimated 2.6 million deaths each year. In 2013, there were about 400 deaths every day or 16 deaths every hour. Measles vaccination resulted in a 75% drop in measles deaths between 2000 and 2013 worldwide. In this map, you can see that many countries worldwide has reported confirmed cases of measles, so the virus is circulating around all the world. Some measles facts in Republic of Macedonia. Measles is a mandatory notifiable disease by law in Macedonia. Each year there are sporadic cases. We have adopted a strategy for elimination of measles, rubella, and congenital rubella infections. But recently there are some anti-vaccinations movements, and in the last 5 years in Macedonia experienced 2 outbreaks. The first time we have introduced the vaccination against measles in 1972, like measles contained vaccine, the first with 1 dose. And since 1972 to 2010, there were some changes relating to immunization for measles in our calendar. In 1987, were introduced the vaccination with 2 doses with measles containing vaccine, and you can see the changes in the table. These graphs show you the measles incidence in Macedonia during the period 1990-10 up to 2014. And you can see in the last 5 years we have experienced these 2 outbreaks. In this graph you can show the vaccine coverage of measles from 1976 to 2014. With the blue line, there is the vaccine coverage with 1 dose, and with the red one is the vaccine coverage with 2 doses. As you can see, in the early 90s, we have a rapid decline in vaccine coverage. It was the time when Macedonia got the independence from Yugoslavia. And in this period, the main provider of the vaccines were based on NGOs, WHO, and other such societies. After 2000 until now, the coverage of vaccination in Macedonia is estimated like 92 to 99%. But in the last 5 years, you can see that there is also a declining or decreasing trend of vaccination. The objectives of my study is to describe the last measles outbreak in Republic of Macedonia, to assess the vaccination status of cases, and to provide recommendations for preventing further outbreaks. We made a descriptive analysis by person, place, and time. A clinical case definition was a person with a maculopapular rash more than 3 days, fever more than 38 degrees Celsius, and at least one of the following: cough, runny nose, conjunctivitis or Koplik spots after the 1st January 2014 in Skopje. Lab-confirmed cases is a case that meets the clinical case definition and has laboratory confirmation of measles virus infection. ELISA was used for confirmation. And epidemiology confirmed cases is a patient who meets the clinical case definition and has direct contact with another laboratory confirmed measles case. A structuring questionnaire was used for collecting data, and collecting data was done by local epidemiologists. The result. You can see in the graph the distribution of cases by age group and vaccination status in Skopje during the whole period, January to June 2014. A total number of 112 cases were notified. 87.5% of cases had a known vaccinational status. Out of them, 91% were unvaccinated, 7% had vaccination with 1 dose, and 2% with 2 doses. In this slide, I have prepared the age-specific attack rates. As you can see, the most affected age group were those 0 to 5 years. This is the distribution of cases by week of rash onset. The first cases was detected in the second week of the year. The peak of the outbreak were in the 13th week of the year or in the first week of April, and the last cases was in June. With red, there are all the cases are laboratory confirmed. The green color is showing you the epidemiologic linked cases, and the others clinical cases. Out of 112 cases, 64 were lab and epidemiological confirmed. This is the geographical distribution of cases. The highest number of cases were reported in the municipality, Karpoš and Center. Distribution of cases by complications. Out of 112 cases reported, 97 of them didn't have complications. 12 cases were reported pneumonia. For 3 cases, there were no data about complications. And how did we manage the situation? An outbreak control team were created. The institutions involved in this team were from the Ministry of Health, Institute of Public Health, and the Center of Public Health. And what they have done, it is work in the case interview, in contact tracing, immunization advice of cases and contacts, checking immunization histories, vaccination of susceptible contacts, those that were not vaccinated or partially vaccinated, and speed the delivery of catch-up vaccination in vaccinational centers, meanwhile, and campaigns for immunizations. The conclusions. This is the second outbreak in last 5 years. Children under 5 years were at higher risk because of not being vaccinated. 95% of those were unvaccinated. 17.8% belong to the age group under year, which are at high risk, possible due to low levels of maternal antibodies. Older than 30 years, 42.8%, were at higher risk due to lower vaccination coverage and immunization schedule, with only 1 dose of measles-containing vaccine from 1972 to 1987. What we recommend in case of outbreak, lowering the age of primary vaccination should be considered also as early by revaccination of children under 5 years. Post-exposure guidelines recommend vaccination of contacts with the case of measles when they are unprotected and aged 6 months or older. We need also to make catch-up campaigns and vaccine campaigns. Thank you for your attention.
So our first question.
Thank you very much for a very nice presentation. You concluded that this may in part be related to low vaccination coverage over a few years ago and the effect on maternal antibodies. So given that, were you able to look at the attack rates in just the first year of life? And it would also be interesting to know whether you could possibly look at the age, if you did see the attack rate highest in the very first year of life, if you could look to see if there was a difference in the attack rate between mothers of different ages.
Can I go back in the...
Please.
And please, can you repeat your question? So we are in this one.
Yes, so in that you look at the attack rate, but it's from 0 to 4 years. And so within that, can you look at the number of cases and the attack rate within the first year of life? So here we have it, sorry.
Yes, there are 20 cases under the first year.
Yeah.
Huh?
Yes, yeah.
Yes, all unvaccinated. 100% of these cases are unvaccinated. The attack rates, I calculated it in the age group of 0 to 4. What is?
So that was useful, that slide before. I'd forgotten that you had that slide before, which showed. Yes, but it was just your hypothesis that actual lack of passive transfer of immunity from mothers might be a factor in this. I think you had one of your slides was suggesting that. Yes. Yes,
we can suggest. I'm thinking to understand you because.
So if lack of transfer of maternal antibody was a factor, then would it be possible to look at the age of the mothers whose children developed measles in the first year of life, and to see whether actually the mean age of those mothers put them in the age group where vaccination levels were lower, and that mothers, perhaps younger mothers, had a lower risk, yes? Yes. Might be interesting to look at if you had the data.
Yeah.
Ahmed, please.
Thank you for your presentation. In the same question, because when your story, you are involved for strategy for elimination for WHO.
I cannot understand,
okay.
So speak slowly and clearly. Okay.
You are involved for strategy for elimination for measles adopted by WHO, if I understand. But when I like this outbreak, I have two comments. You are vaccinated in 13 months and 70 years. First dose. I can repeat?
Can you? To go in the vaccination schedule. Okay. Because...
Yes.
This one? Okay.
Yes. Your first dose and 30 months, and second dose and 7 years.
So the first, your question is to explain the vaccination,
no.
Or what?
This is my question, the second.
No.
Now you have the transmission of measles in your population. It is not object, not situation for elimination. That proposed comment is not ideal to can reduce the first dose to 9 months because you have circulation, and maybe 7 years to 2 years, because waiting between 1 year to 7 months, you have a lot of risk for children to have measles. That's my question.
Can
Okay.
So if
don't
it's
understand.
maybe
I
your
repeat the
question.
question. I
Or
repeat the question
something
slowly.
in,
Your strategy for vaccination for measles, you have now 2 appointments. The first dose in 13 months and second dose in 7 years.
the first dose, the situation now, the first dose in 13 months and the second dose is in 6 years. Situation like now.
6 years now.
Okay.
Between these 13 months and 6 years, you have a long period, but
Yes.
now you have transmission.
Yes.
This is the comment. Can you reduce the first dose at 9 months because you have circulation, you have more risk for children, because you have a lot of number less than 1 year, and reduce the second dose and 2 years in order to have more chance to protect your children? Just in the comment. It's clear?
So as I understand, you are asking to remove the ages for vaccinations, but these are the guidelines, and it's not recommended to give the vaccine before the 12 months. These WHO vaccinations are, if you can do it in outbreaks, but you can go again with these schedules. And it is considering to give the vaccination before, but during the outbreaks. But in a normally life, these are the guides. And vaccination with 1 dose is highly effective. It is 30% effective. So, but the main reason, the main risk factor of these people that are getting measles is that they are not being vaccinated. And these persons that are after 30 years, they belong to the period when they were covered by 1 dose measles-contained vaccines. So this period to 19, this one, just a second. The person in these investigations older than 30 years belong to this year that were covered with vaccination with 1 dose and the lower coverage. I made this relation. But whenever they were, more of them were unvaccinated. So.
Can I rephrase your question? The question. You want? Okay.
Okay. Thank you for your presentation. I hope that my English will be understood good, because I'm not so good in English also. My question is about this slide that you said that you have low coverage of vaccination in 90s because of Macedonia is going for independence from Yugoslavia. And despite that, there's no outbreak of measles after that period. And in 2014, you have 2 outbreaks. In the last 5 years, you have 2 outbreaks despite the good coverage of the vaccination. Is there an explanation why here we don't have any outbreaks after 90s? And in the last 5 years, I will have another question in order
To finish the first one, because I will.
The first one, why we don't have outbreaks?
So,
Outbreaks, is there an explanation for this?
Despite
The good coverage here, in 2010 till nowadays, you have a coverage of more than 95%. And despite that, you have outbreaks.
So, just to explain. The first question is why we have had two outbreaks. So, the outbreaks in 2011, I guess. In this period, we had another outbreak of mumps. And my opinion, since we had a big outbreak in mumps, the vaccine, we made vaccine campaigns and catch-up vaccines, and this mumps is a 3 valence vaccine. And making efforts for vaccinations, the population in this period, the coverage is higher because, no, I am tracing. because and so in this period, since we had another outbreaks of mumps, we made efforts to have vaccination, to make vaccinations. And so my opinion is that is why we have a high degree of coverage. But after that, the outbreak passed and we were relaxed and coming
Another
normally
break.
to not vaccinate.
Okay. This is make me to have two other comments. The one is once you have two outbreaks since in 5 years, why you didn't consider vaccination campaign to all the population or to the high risk population in order to revaccinate them again with a campaign? And also I have on also that you need to do serosurvey in order to assess the effectiveness of the vaccination in your country,
Yes.
because with such high coverage of vaccine and
Yes.
you have outbreaks here, it's a cost to see whether the effectiveness and the culture
Yes,
of the vaccination
but,
and the way
yes.
the vaccine. This is my recommendation to you, that you should make a serosurvey in order not to have another outbreaks in the future.
Yes. Actually, as I have mentioned, we have sporadic cases in our country. The first outbreak, the biggest one, the case came from abroad. In the second outbreak, it was from autochthon virus. And we are doing campaigns, and not so high like in the period of outbreaks. In outbreaks are involving more media, more people. And after outbreaks, I said to you that there are detected some anti-vaccination movements. So they are making their anti-vaccination movements. And just to say that we cannot have a conclusion that the vaccination is not effective in this situation, because 85% didn't have vaccination, and the first 7% had vaccination with only one dose, and it depends. And it was after the period of 30 years. So from this last outbreak, I cannot conclude that vaccination is not secure. This is my opinion. If my colleagues from the epidemiology can give another comments, please take your words.
Okay, Vladimir, please, quickly.
Yes, thank you. Maybe just a quick reference to the latest comment, that despite the high vaccination coverage, we are still facing some outbreaks. Yes, that's true, but this is the national coverage. So what we have to look is also to the coverage on local and regional level. And this was mostly a local level with some municipalities that had actually quite a low coverage. And as Erjona already said, that most of the cases were unvaccinated. So we should not question about the vaccine effectiveness, although the gentleman is completely right, we need to do surveys in order to see.
And just to mention, to give another comment, I already said that 2 cases had 2 doses, but these cases were not lab confirmed. So we cannot say that the vaccine is not a safe one.
No, it's worth, just my recommendation to you, it's worth it to do
Yes, thank
survey.
you.
I'm not talking that your vaccination is not effective, but
Yes.
it's worth to think about to do a survey to all vaccine. That's my recommendation.
Yes, I think that these anti-vaccination movements are very strong now through Facebook. They are very, very. When I read, I just myself started to think it's good to take a vaccine or no. I was just thinking. So, Facebook and Twitter are sometimes very highly spreading.
Erjona. So let's take a last question by Nada.
Thank you very much for the presentation. Very interesting. for this slide, vaccine coverage, what is your source of information? Do you rely on administrative data with administrated vaccine, or do you rely on surveys with household interview? So what is the source of your information for coverage vaccination?
How we get the data. So we have a national program for getting this collecting data. There are some centers for vaccinations. They are made regularly, and they report to the Institute of Public Health. And sometimes we are called when they, in these places that people are going vaccinations, that happen very often when they have not the equipment to realize, they make an alarm. Please, we need help because the percent of vaccination coverage in that place is only 60-40, and we must arrive at least, 90%. I have been involved in such, it's a regular national program, and with reporting. We do it with reporting. My colleague Christina is doing that job. Thank you, Christina. Thank you, Nada.
So I have two quick comments, because I want to collect all the recommendations. We expect from the recommendation that you said in the recommendation that you will have to change the schedule for immunization to be at 1 year and nearer to 1 year. This is what our colleague from Morocco tried to say, that the 2 doses must be near each other and not so far, because you have a lot of cases between 1 and 4 years old. This is what, in your recommendation. The other thing that you said, that you have advised to immunize the cases. I don't know why we can immunize the cases. What we are in need for immunization of the cases. We are, you immunize the contact and so on, but not to immunize the cases. This is my 2 comments. This is in your recommendation.
A recommendation is lowering the age of primary vaccination should be considered
The previous one?
Also as early revaccination of children under 5 years.
The previous one, the slide?
The previous one. These are conclusions.
Conclusion? The previous one, okay. I bet you tired.
Yes, this is how
immunization advice of cases and contacts, yes.
So you are in
immunization advice of cases, this is our case.
Immunization advice of cases and contacts. Because we have to advise, because yes, you have
okay.
Okay, yes, it's my.
No, that's right. Okay.
But okay, you can advise the cases
Yes.
to interact in the context,
Yes.
because
not immunize, but
okay,
how to prevent.
No, I was right. Immunization advice of cases and contacts. I have thought about mentally just advice to speak about the importance of vaccinations of cases and contacts. Just to okay, it's just of terms and of English language. It's not the okay.
Thank you very much.